Welcome back. You're watching The Market. Now, there is a lot of concern and, in fact, watchfulness about Omicron, the variant of concern that everyone is being mindful of right now. And, in fact, as that tally continues to surge, the testing is what is most important at this juncture. Pankaj Poddar caught up with Dr. Om Manchanda, who is the managing director of Dr. Lal PathLabs, to understand how the diagnostics trend has been. Listen in.
See, now diagnostic industry and in general worldwide, we've got now 7 quarters of experience. And if you recall in 2020, when first quarter we had lockdown, and that impacted a non-COVID business. But when lockdown restrictions were lifted, then non-COVID business actually started coming back. And I think one thing that I see now is that we are unlikely to have any impact on non-COVID business because it's somewhat business as usual. There are no strict restrictions like what we saw in the first quarter. The second thing industry has, or in general, what has one seen is that there is a huge capacity build-up for testing in India. And even for us also at Dr. Lal, when we started, we had only one lab in Delhi doing this test. Today, we have nearly 20 labs across the country doing this test. And our capacity, broadly speaking, has really gone up 10 to 15 times in these 6-7 quarters. So to answer your question in terms of are we really prepared in case situation demands, the answer is yes, that the country and our company also has built strong capacity to take up that demand in case it happens.
Right. Just in terms of how people are living in now, everything is open, everything is, going ahead in terms of the operations that they used to do. Of course, people are trying to maintain whatever protocol is possible. But with the vaccination drive, with the learning of social distancing, you think the wave may be curved versus what it has been earlier?
So I'm actually not expert on this subject per se. I guess scientific community will talk more about this. But what one is hearing is that this particular virus, the new mutant, is more transmissible and is less severe on symptoms. So if I study the trend of last 7 quarters of COVID, we had 2 kinds of testing showing up. One was typically RT-PCR or any diagnostic tests. So where you really want to know whether the person is COVID positive or not. So once the person is positive, then the next round of testing begins primarily when the person or patient visits a doctor and the new kind of tests are being prescribed. Those group of tests, we normally call them as COVID-allied tests. So we saw COVID-allied testing going up, especially in wave 2 in April, May this year. My sense is that first, when the infection picks up, when the number of cases pick up, it normally, the first level of testing, which is RT-PCR testing or any diagnostic test, that really go up. So allied testing normally happens when there are very high level of hospitalization. So I guess the COVID testing pattern also will go along with in that direction.
Right. So in the last 2 years, we've seen one thing for companies like you. One is the COVID testing, one is the non-COVID business. Has the COVID business now come back to the pre-pandemic level? Also in 2022, say if COVID cases also rise, people have been, delaying their surgeries, trying to avoid any other work in terms of healthcare space. But you believe that that business will continue to see the way it used to, even if COVID cases rises from here on?
You mean non-COVID business, right?
Yeah. Has it seen a normalization, basically?
Yes. I think it's clearly visible in recent trends that non-COVID business actually has seen normalization. And we are seeing growth curve coming back to what it used to be pre-pandemic levels. Maybe a few exceptions here and there, but broadly at a macro level, I do believe that non-COVID growth trends are back to what one used to experience in pre-COVID times. As far as the COVID is concerned, it's a highly volatile, it's very unpredictable. The variations are so high, the bottom, if it is 1, the spike could actually be 6-7 times. So it's just that not possible to really predict what COVID trajectory is going to look like. But companies like us, which are really focused on sticky part of the business, which is non-COVID, and I think that's back to what it used to be pre-COVID levels.
Right, understood, sir. So we spoke to various hospital companies and they said that in COVID there was a lot of learning of cost saving. Is that similar for diagnostic companies? You believe that a lot of cost saving may actually stay back?
Yeah, I think so, because one, of course, COVID itself taught us a lot of things in terms of managing costs, because the pricing of COVID when it started was much higher than what it is right now. And it really put pressure on all of us to manage our cost, productivity, etc. Similarly, we have also used digital or technology in a big way to really bring efficiencies in our system. And a lot of there is a sort of a landscape in terms of the flow of patients also has changed, and a lot of business, I guess, for hospitals has moved on to teleconsultations. For us also, it's moved to home collections. People nowadays book online, pay online. They are actually all trying to reduce the length of stay when they visit our facility. So I think there is a change in the consumer or patient behavior, where they are open to using technology to reduce the sort of a length of stay when they are in healthcare institution. So all in all put together, I think it's clearly visible that companies have been able to really look at ways and means of reducing costs and increase productivity.